Hi, I'm Dr. Devin Savage from Archlifter. If you're watching this video, chances are you're dealing with spinal pain, and you may have been diagnosed with degenerative disc disease or DDD. This video series is designed to give you a perspective of the problem so you can better understand how your condition developed over time and how to make better decisions regarding prevention and therapies that you may be offered. When you decide to try the Archlifter, you will need to do your homework first. You can start by going out to get a pull-up bar. This one is typical, bought at a place like Walmart or off of Amazon.com. It should be quite sturdy. You need to check that it's put together correctly and all the fasteners are fully tightened. Test it with your body weight and make sure it's centered over the door correctly. Do not put more weight than the bar is designed to hold. You will also need to determine what kind of mouthpiece you're going to use. My personal favorite is the dental mouthpiece. My upper molars are in great shape. I've had all the old silver fillings replaced with much stronger ceramic fillings, and I've no missing teeth, bridges, or implants to worry about. If you're unsure of your dental condition, go get a checkup. Tell your dentist what you're planning to do. You may need to get an upper splint made of hard plastic. This will hold all your teeth together while you're using the Archlifter, taking the load off of any one particular tooth. While you're seeing doctors, why not ask your GP or orthopedic doctor if you can safely use spinal traction? And lastly, don't forget the hygienic plastic barriers. Set up your Archlifter over the doorway like this. Make sure you have everything assembled correctly. Double check the pull-up bar before applying weight. Next, you can play with the settings a little. From testing results with the dental mouthpiece, it seems that most people prefer the more forward settings for the Archlifter angle. You put your head in the device first, put the mouthpiece into your mouth, then place the mouthpiece strut into the slot and seat it all the way. Next, try with a little traction. Use the strap or handles to precisely control the traction force. Go back and forth with your feet a little. This changes the angle of force on your spine slightly. You can experiment with different angles to see when you get the most relief. You don't need to use a lot of force. Just start with what feels comfortable. You will need to learn to loosen up your muscles a bit so that the traction forces can go down your spine. If you're all tensed up, the traction forces won't even reach your spine. At first glance, the Archlifter looks like a neck traction device only, but the Archlifter is also very effective for the middle and lower back as well. You can use the weight of your legs and lower torso to traction your middle and lower spine. See how I hold onto the handles to direct the traction forces down to lower levels. This feels really amazing after a long day at work or after a long road trip or hike. You can pick up your legs and really traction your lower back this way with the extension and flexion exercises that were made popular by physical therapist Robin McKenzie back in 1981. This is impossible to do on an inversion table, but with the Archlifter it's quite easy. Read up on the McKenzie method for more info about these very, very useful exercises. So now you know how to start getting your back back. All you need is an Archlifter. For more information, visit Archlifter.com and our page on Facebook. Please like, follow, and share. Thank you.